And we are live. Hi, good evening, everyone. Welcome to Level Up Live. I am your host, Dr. Sharita Gaskins-Tillett. Welcome to Level Up Live, where we feature the remarkable contributions of women physicians, both inside and outside of the exam room. And I am so happy to have a really special guest with us tonight. But I just want to give a couple more seconds to give folks to get in, and then we will get started. So I'm just going to pull up her bio. So we have with us this evening Dr. Nicole Rochester. She is a board certified pediatrician, TEDx and keynote speaker, and CEO of Your GPS Doc LLC, an innovative company whose mission is to eliminate health disparities, bridge the gap between healthcare teams, patients, and families, and empower, educate, and advocate for patients and family caregivers struggling to navigate the healthcare system. Dr. Rochester was inspired to start her company after caring for her late father and witnessing the complicated healthcare system from the other side of the stethoscope. Dr. Rochester has been featured on television and radio and is a frequent podcast guest, has an active presence on social media, and has contributed to more than 30 digital publications. She speaks locally and nationally about health equity, navigating the healthcare system, and elevating the patient and family caregiver voice. Dr. Rochester has served as a consultant for the Maryland Department of Health, the Maryland Patient Safety Center, and the Maryland Hospital Association, and is currently the physician co-lead for the BIRTH Birth Equity Maryland, a statewide maternal health equity initiative for non-obstetric providers. Welcome, Dr. Rochester.
Thank you, Dr. Gaskins-Tillett. I'm so excited to be here. Thanks for having me.
Well, I'm excited to have you. So I like to have my guests start by telling us about their journey through medicine. Tell us more about your background in medicine, and then tell us some about your transition.
Sure. So I am a pediatrician by training. I've wanted to be a pediatrician since I was like 8 or 9 years old. And I went to did undergrad at Johns Hopkins University. I should add I'm a Maryland native, and you'll understand that when I state my training. So I did undergrad at Johns Hopkins University, went to medical school at the University of Maryland, and then did my pediatric residency training at Children's National in Washington, D.C. So I have stayed locally throughout my training. And initially, when I finished pediatric residency in 2000, which I can't believe it was that long ago, my first job was as a primary care pediatrician with a large HMO. And that was great. I think it was a great way to start my career in pediatrics. In residency, I kind of struggled between whether I wanted to be in the hospital or whether I wanted to do primary care. And that was kind of like the emergence of hospital medicine, at least for pediatrics. There were very few jobs in pediatric hospital medicine, but I was someone who in residency, I really enjoyed the hospital. Like I liked the fast pace, I liked doing procedures, but I also loved spending time with my patients and getting to know them. So I went back and forth and ultimately decided to do primary care. And I did that for almost 4 years and loved it. But what I found is that I wasn't able to practice medicine the way that they wanted me to practice medicine. And so even back then, over 20 years ago, there was this push to be productive, to see patients, fairly quickly, to see more and more and more patients. We were routinely double booked, triple booked. And I was known as the doctor who was always running late because I sat down, I looked my patients in the eye, I talked to the moms and dads and, spent what I thought was an appropriate amount of time.
Cool.
And so it was appreciated by my patients once I got in the room, but I'm sure that many complained about me,
Yes.
just always being late. And I just remember always opening the exam room door and saying, I'm really sorry, you've been waiting. I'm really sorry you've been waiting. And so after almost 4 years, I just started to feel like that was no longer the best place for me. And I really wanted to show up the way that I wanted to show up and really be authentic and just be able to get to know my patients better. So it may sound weird that I would leave primary care and go to hospital medicine to have more time with patients. But what I found in the hospital setting is because there's no appointments and your patients are hospitalized, you kind of have a captive audience.
Right.
So I was not only able to, see them in the mornings during rounds with the team, but then I can check back in on patients as many times a day as I wanted to. And so I really leveraged that and used that, even though they had, in most cases, just met me. That was an opportunity for me to really build relationships with people, even if they were only in the hospital for a few days. So I started out, worked in several different hospital settings, ultimately ended up in academic medicine, where I worked in a community hospital, but had the pleasure of teaching medical students and pediatric residents. Also became the medical director of our physician group. So that was like my dream job. I was doing clinical care, I was doing administrative things, and I was teaching. So I thought that that was going to be the end of the road, and maybe I would kind of work my way up the hospital ladder. And then everything changed. I don't know if you want me to pause here, because this is kind of when the transition happened.
Yeah. Well, just tell us about the transition, because it's interesting, because I think that happens to a lot of us, that we find ourselves in a place where we think, we've kind of reached where we want to be, and things are good and you're going along well, and then life happens, right?
Yes.
So tell us about life happening.
Okay. Yes, life happened. So around 2010, my late father, who had a lot of chronic health conditions, just really started to experience some acute decline in his health. And it required my two older sisters and I to rather abruptly kind of jump in and begin caring for him. And that started with him
Now,
staying.
hold on. Are all of you medical?
No, so I'm a physician. One of my older sisters is a nurse, and then our oldest sister is an engineer who can't stand the sight of blood. But two of my older sisters, well, myself and one of my older sisters are both in healthcare, and that definitely helped. So he went through a series of transitions, from living in his home and us taking turns checking on him and bringing him meals, and to us moving him into an assisted living facility. He was in and out of the hospital, lots of ER visits, lots of short stays and sometimes longer stays in rehab facilities after being hospitalized. And while all of us took turns doing a little bit of everything as the physician in the family, my primary role in the caregiving team was to accompany my dad to his appointments and to kind of oversee his medical care. And that was a very eye-opening experience. Up until that point, we had some illnesses in our family, and actually we lost our mom many years earlier to leukemia. But when my mom passed away, I was in medical school, didn't really know a whole lot. And then I was healthy. My family members, for the most part, were healthy. So I really had very limited exposure to healthcare other than my dream world of pediatrics.
Right.
And so going to these appointments with my dad and being in and out of the hospital with him, it was really eye-opening in terms of just the way that he was treated. There were a lot of times I felt like he was being ignored by the healthcare team. I was being ignored.
Now, when you went into these appointments with him, did you let them know that you were a medical professional?
So that's the key. So initially I did not, because I've never been someone that walks around telling everybody what I do for a living. In hindsight, it probably would have been nice for me to have done that, but I really wanted to just show up as his daughter. But after, 3 or 4 or 5 encounters where I just kept getting extremely frustrated and they were not really validating my concerns, out of desperation, I spoke up and shared that I was a doctor. And that's when everything changed. And suddenly they were spending more time with him, with me. They were more interested in what I had to say. And I saw over the course of months to, years, I saw his healthcare improve. And it was still difficult. Like navigating the healthcare system, even then, was still very challenging. But I was able to really powerfully advocate for my dad because of the knowledge that I have as a doctor, being able to ask questions that the average layperson wouldn't even know to ask, my expertise and experience in hospital settings and knowing how to escalate matters, being confident in pushing back when it was necessary. And I hate to say it, but even my influence. And
Right.
once they know you're a doctor, oh, this is his daughter's a doctor, and things move a little faster. And so I would always like that. I was grateful that my dad had that, advantage, so to speak, and I recognized that privilege. But then I would always think about, what if I wasn't a doctor, and what do all the other people do when their dad gets sick or their mom gets sick or their
Right.
loved one. So he passed away in 2013, and I was still in my dream job, but I just couldn't stop thinking about the experiences that we had with my dad. And I started feeling this pull that there was something else that I was supposed to be doing. You can relate to the fact that when you spent your whole adult life, on this one thing,
Right.
and you have invested money and you have loans and all those things, it's really difficult to even consider doing something else. And I never had a desire to be an entrepreneur. So long story short, after a couple of years, I could not resist the pull anymore. And I left my amazing job because they wouldn't let me do this on the side. And I started my business, Your GPS Doc, which is a health advocacy and healthcare consulting company. And at the time when I first started, the main purpose was to help patients and family caregivers understand and navigate the healthcare system.
So, what kinds of things did you find weren't happening with your dad? Before you let them know you were a physician, how did you find they were treating him, interacting with him?
One of the big problems with my dad is that he had been diagnosed with vascular dementia. So it wasn't like Alzheimer's. He knew where he was, he knew who he was, he knew who we were. Some of the signs and symptoms were very subtle, and it had a lot to do with like his ability to process information. And so they would often, they didn't appreciate the fact that my dad wasn't really sharing everything. And so when I would chime in and try to fill in the gaps, I was kind of like, sit over there, little girl, like pushed to the side. And so there was often a minimization of his symptoms. And my sisters and I had to like repeatedly just like fight for diagnostic tests and things like that before he had that diagnosis, because we knew that something was wrong. One of the other issues is that because he had so many chronic medical conditions, he had a lot of different doctors and none of them were talking to each other.
Mm.
So, he had an endocrinologist for his diabetes. He had a cardiologist for his heart disease. He had a nephrologist for his kidney disease and a bunch of other ologists. And sometimes there was redundancy in the medications that he was being prescribed. And there was just a lack of coordination of care. I don't think his primary care doctor did as good a job as she could have in keeping it all together. And so a lot of things were falling through the cracks with him. And I would say those are the main things: just poor communication, poor coordination between the doctors on the medical team, and then just like not like validating him as a human.
So now let's switch a little bit to when you decided to leave your dream job.
Yeah.
That had to be really something. So tell me what went on, what kind of mindset shifts did you experience that compelled you to leave this job that was your dream job to pursue something like entrepreneurship, which you never even considered?
I would say the mindset shifts definitely came later. Honestly, there was such a strong spiritual pull. Like I really felt like God was calling me to this new thing. And I didn't even quite know what the new thing was, but it got to a point, it started out with just these little messages. Once friends in my circle, doctors and non-doctors, learned more about like what I had, how I had to advocate for my dad, I started getting lots of text messages, phone calls, emails from people in my circle saying like, hey, my mom's in the hospital. This is going on. What should I do? Or, hey, my grandma just got sent to a rehab facility. So at first I was like, okay, this is random. But then it was just, it was just over and over. And just other things, random TV commercials. There were just so many things that were happening that made me feel like this was really the thing that I was supposed to be doing. And initially, I wasn't going to leave my job, as I alluded to. I was very scared about leaving that behind, and I still loved my job. And so I thought that I would just start this little business and do it on the side. And then maybe if it ever grew to something, I would leave. But because of my contract and because of the human resources department not having a clear understanding of what health advocacy is and thinking that it would be a conflict of interest, they kind of said, well, you can't do this. And that for me was like the line in the sand. Like, that's when I got my courage, because at that moment, I just kind of knew in my gut, like, well, if they're not going to let me do these together, do both of them, then I just have to leave. Now, I didn't completely just leap out with no safety net. I had to give 6 months notice because I had a faculty position, and that was like the best thing ever, because I used that time to pay off the rest of my student loans, to pay off my car, to take care of like some, credit card debt, and also to find a non-clinical job that was 100% remote. So that would allow me to work from home, and have a lot of flexibility as I began this journey of starting Your GPS Doc.
So now you mentioned how the human resources responded. How about your colleagues, your fellow physicians? How did they respond when you talked about this?
The interesting thing, I got a lot of support. I really don't remember any naysayers. I think because like my colleagues had seen me go through this journey with my dad. They knew that my dad had passed away. They saw the impact that had on me. And so I think because my launching a business was directly connected to my experience with my late father, it was like a no-brainer. So every time I would tell somebody about this idea and tie it to my experience with my dad, they were just like intrigued, like, oh my gosh. And of course, many people are like, oh my gosh, I had similar experiences with my mom or my dad or my grandmother. I wish, there was somebody like you when I went through this. So I think because of that, and like my why was so powerful, I didn't have anybody say, are you crazy, girl? Like, you spent all your life wanting to be, becoming a doctor.
Right.
And my family, my husband, my kids, my siblings, everybody in my family was so incredibly supportive, and no one even questioned that it was going to be a success. Other than I probably had more doubts than anybody else.
Wow. So now tell us about your GPS docs. Tell us what you do there, who you help.
Mm-hmm. So the company has evolved. So I'll tell you, when I first started, it was primarily a health advocacy company, and I help patients and family caregivers. My heart is with family caregivers because that's who I identify with. So I'm always trying to connect with other family caregivers, especially adult children that are trying to take care of their aging parents, their ill parents. But I also had a lot of clients who themselves were patients, and it really involves anything related to navigating the healthcare system. So some of my clients, it involves helping them understand their medical conditions, attending their doctor's appointments, which even before COVID for me was like mostly remote, by phone, by FaceTime, prepping them for doctor's appointments and making sure that they had the language to effectively communicate with their doctors, helping them with new diagnoses and kind of mapping out the plan, bridging that communication gap between the patient and the family members and the medical team, and just being able to kind of go back and forth between both, but also helping them with transitions in care. So with nursing home or needing to go to an assisted living facility, and doing the research on those facilities so that they know what's a high quality facility versus a low quality facility. Sometimes facilitating second opinions, helping during hospital stays, transfers of care, all of those things. Insurance, helping them understand their insurance benefits, sometimes helping them choose a better health insurance plan. So that was primarily what I did for the first 3 years. And I was also doing some speaking, mostly with caregiver communities, just teaching them about how to navigate and how to advocate for themselves. And then with the murder of George Floyd and everything else that happened in COVID, with 2020 and this whole racial reckoning that our country went through, I started doing more speaking about structural racism and bias in medicine, and really started talking a lot more about health equity, which is something that I've been passionate about since medical school. And that opened up a lot of opportunities for me to speak in that area, but also be a consultant. And so now I'm doing a lot more healthcare consulting in health equity, in patient and family engagement. And that has kind of taken me away from the health advocacy, So I have less health advocacy client, like one-on-one clients.
Yes.
And ultimately, what I'm working on in 2023 and beyond is really merging health equity and health advocacy, because I believe strongly that when we educate and empower communities, that they can begin to advocate for themselves, and that that's going to be a key to us getting the care that we need and deserve. So one of the things I'm working on is developing a curriculum to train just normal everyday lay people in the community to be their own health advocate and to be advocates for their church members, their family members, those in their neighborhood. So that's kind of like the latest thing that's going on at my company.
I mean, it sounds like what you were offering your clients was really robust. You know, you're talking
Yeah.
about insurance and appointments and, translating between the healthcare team and the patient. How did you structure your schedule? How many clients were you able to take on at one time? Because it seems like, one or two, and
Yeah.
especially one or two with some significant issues.
Yep. That is such a great question. I appreciate you noticing that, because I will tell you, again, as a brand new entrepreneur back in 2017, 2018, that was the learning curve. I was learning how complex these clients were. What was it going to involve? How much of my time was it going to take? And at the time, I had this other part-time non-clinical job. So I had to be very careful and very intentional about taking on more clients. And so over time, what I learned is that having a balance of like a high acuity patient who's like in the hospital, particularly if they're in the ICU and there's a lot going on, I wouldn't take on more than one or two of those clients at a time. But I could balance that maybe with someone who had a stable chronic disease who really just kind of needed me every now and then, or someone who needed me to review their health insurance plan and let them know, like, what is all this language mean, and is this giving me the care that I need? So over time, I really got strategic about what types of clients I would take on. But to your point, typically, especially when I was working part-time, generally about 3 would be the limit for how many I
Yeah,
could take at one
I
time.
would think so, because I
Yeah.
mean, like I said, it just sounds really, really time consuming. And then did you select them for like a brief thing? They just engaged you to look over their health plan and that would be it? Or do you have contracts with people where, they know that, for the next year or next 2 years, I have Dr. Rochester here if I need her?
Yeah, it was a combination and still is a combination of both. So with my services, the like health insurance or helping them locate a reliable, high quality skilled nursing facility for their loved one, those types of things are limited. It may take me 4 or 5, maybe 6 hours to gather all the research and then to meet with the family and discuss the options. So those are kind of what I call like one and done. But then I have other clients I've had clients as long as 2 years, where it's an ongoing process. They're in and out of the hospital, or they're managing a chronic illness, and I'm helping them or their family members navigate, new challenges. So it really depends on what their needs are. But typically, I would have some long-term clients and then some short-term clients who just need this one thing, and then after I've given them that, they've moved on.
So, you've talked about having plans to have a course to educate lay people to be able to act as health advocates. Have you thought about expanding, basically replicating yourself um, within your GPS docs so that you're able to provide more services to other people?
I have. So towards the end of last year, I really went through an entire process of developing my strategic plan and like re-evaluating where my company is. It's grown a lot over the last 5 years. And I definitely have gotten to a point where I've like reached my capacity as just me as the sole
Sure.
advocate. So one of the things that I absolutely entertained was a model where I would bring on more health advocates, either as employees or maybe as subcontractors, and even thinking about working with insurance companies or employers so that someone else would potentially pay for these services, because that's another kind of a challenge that I face, just my own like ethical, more, the
Yeah.
people that need me the most may not have the money to be able to pay. But when I really started thinking about the company that I would love to lead, in the next 5-10 years, I questioned whether I really wanted to be in charge of a bunch of other advocates. And is that like what lights me up every morning, overseeing and supervising other advocates? And so that's kind of what led me to the model that I'm entertaining now, which is training other advocates in the community and partnering with religious organizations, churches and other faith-based communities, community-based organizations, and really like growing, like, I mean, I'm saying an army, but like an army
Yes.
of health advocates. So I have not completely abandoned the idea of bringing on more advocates, and that may be another way that my company grows. But right now, I'm really, really committed to some like boots on the ground work within the community.
Yeah. So tell us about some of that boots on the ground work. I know you mentioned the health equity that you've been doing, some speaking and other things. Tell us about some of those projects.
Sure. So yeah, I've had the opportunity to speak at medical schools and hospitals and health systems and other healthcare related organizations about health equity, about the need to diversify the healthcare workforce, about my own experiences as a Black doctor and some of the biases and microaggressions and discrimination that we face, as well as working on some really cool projects. So I had the opportunity to work with the Maryland Department of Health for almost 2 years on a project with diabetes, and I was basically contracted to form and then facilitate a patient and family caregiver advisory group. And we had some amazing men and women who either themselves have diabetes or they're caring for a loved one with diabetes. And for 18 months, they pretty much advised the Maryland Diabetes Quality Task Force on some of their initiatives, provided that critically important insight from those who are actually managing this condition. So I was really proud of that work. I miss meeting with them. We used to meet once a month, and it was just a great time. Currently, I am the physician co-lead for, you mentioned in my intro, for an initiative in Maryland called Birth Equity Maryland. And that stands for Breaking Inequality, Reimagining Transformative Healthcare. And that's a maternal health equity initiative that ties into our state's goal to reduce maternal morbidity and reduce the disparities that we see, not only in Maryland, but really throughout the country.
Yeah.
So we have a program that provides education around health disparities and the causes of morbidity and mortality among women, that provides education about structural racism and bias and how they contribute to maternal health disparities, and also some training around teamwork and how to work as a team to identify disparities, to speak up. So it's like empowering all the members of the healthcare team to speak up. And that initiative is targeting primarily emergency departments throughout the state of Maryland, as well as some primary care and some community-based sites that serve women of childbearing age. So that's been really, really exciting work.
Wow. We have a comment in the chat to someone telling you fantastic work.
Oh, thank
Now
you.
I have a question for you. So
Yeah.
many of our viewers are physicians, physician women. How do you, as a physician, if break into this health equity field? Because I read your bio. You don't mention any specific training in that area, yet you're doing lots and lots of work there. So tell me, how did you prepare yourself for that work?
I love this question because it really speaks to what I now call imposter experience, what a lot of people refer to as imposter syndrome. And I really like, my message to any female doctor watching is that we need to learn more how to leverage our own personal and professional experiences. I can tell you again, as an entrepreneur who also happens to be a doctor, I have struggled with this idea of, do I need to get an MBA? Do I need to go back to school? Do I need another degree? Do I need more letters after my name? And the reality is, with health equity, as I mentioned briefly earlier, I've been talking about and like advocating for health equity since I was a medical student, like when it wasn't even, the hot topic like it is now. And and then what I've done in terms of kind of getting myself prepared is, as you know, all of us doctors, we are perpetual learners.
Yes.
So when I tell you, in the last 2, 3, 4 years, I have probably attended over 500 hours of webinars. Like I'm basically getting my own continuing education, often without getting those credits. But
Right.
I am always looking for ways to grow my knowledge. I read a lot. I'm always reading, research as it relates to health disparities. I follow some of the people, the pioneers like Dr. Kamara Jones and people that have been doing this work far longer than I am. And anytime there's an opportunity to attend a conference or view a webinar, then I am doing that. And so that's really how I have grown my own body of knowledge. I did take one course. I do have a certification, DEI in the workplace. And that was something that was offered towards the beginning of the pandemic by, I think it was the University of South Florida. And when I got in, it was totally free of charge. And so I did get that certification. But ultimately, we have so much knowledge and so much expertise just by virtue of practicing medicine, being in healthcare, and certainly for those of us who are people of color, we know all about health disparities. Many of us have experienced them ourselves. So I think that in terms of like breaking in, for me, everything I've done, I just need to say this, has been divinely ordered. Like I don't want to take credit for any of this because when I go back and look at how everything lined up, it was way beyond me.
It was part of the plan, right?
It was definitely part of the plan. But for me, giving that, like I gave these 2 talks for the Maryland Healthcare Education Institute, and it was attended by, or these talks were attended by healthcare leaders in our state. And those talks about health disparities and structural racism just led to all of these other opportunities. And so I would say for me, like that's how it all started. And so I think I would encourage your viewers and listeners to just lean into what your passion. If you feel like something that you have a purpose, if we have more than one purpose, because I was stuck in that, like, well, I know for sure that I was meant to be a doctor. Like that doesn't mean that that's the only thing that I was meant to be or that you were meant to be. So we have to understand that we have many gifts and talents beyond medicine. And sometimes, it's time for us to explore some of those other gifts and talents as well.
Right. And, and also you're having a tremendous impact. I think I really admire that you didn't stay, because I would think there was a measure of comfort being where you were. You'd been in that position for a while. You had you were the medical director, you have a prestige in the community, and then you just pivot to this completely different thing, and even within this completely different thing, you're pivoting again. And so I really admire that you're following the leading, I guess, of your heart and your consciousness and all of those things. And I applaud you for that. And thank you. And thank you for the work that you're doing. We do have a couple of other comments in the chat. Someone says, so true. We have so many skills that we can leverage. Also, my mind is blown that you're a pediatrician, because this has been a limiting belief that I am now shedding, that pediatrics is not portable. So see, look at that.
Oh, yes. Whoever that is, please reach out to me. I would love to talk to you.
Yeah, and I think that's where a lot of people get stuck. A lot of us get stuck because we think, okay, I'm not qualified to talk about health equity. How do I establish myself as a thought leader in this space? What makes me, and it's actually in another vein, I had a friend ask me, how do I become a speaker? Now, this is actually someone who is a speaker. Like they speak for a living, but they don't speak about their own things. They speak in a specific area. And she said to me, how do I establish myself as a speaker? I said, well, honestly, you just tell people that you are.
Listen,
right?
That's it. That is it. It took me a while to get there. But once I spoke a few times and I'm like, okay, this is working out. I put on my LinkedIn, I'm a speaker. Once I started doing some health equity work and people started engaging with me and paying me for my services, now my LinkedIn says I'm a health equity consultant, and I am. Yes. So yeah, you just have to own it. You have to own it and understand, just like medicine, when we first finished medical school, we first finished residency, we didn't know all the things, right? But did we not call ourselves a doctor?
Right. Because
we called ourselves a doctor, and we learned. Yeah. Exactly. And it's the same thing with speaking, consulting, all of the other things that we can do as physicians, you learn as you grow, and I'm getting better and better and better like everybody else.
Yeah, yeah. Like I said, I love that because I know that a lot of us, we limit ourselves because we do think that, and you know, there've been studies that talk about this with women in particular, that we limit ourselves, that we think that we have to have all of these qualifications to be able to
Yep.
do something, you know, as opposed to men. Like I think they said men only have to have like 20% of the qualifications to apply for a job, and we have to have 100% before we even throw our hat in the ring. So
Yes.
you know, I think it's great that, you know, you're talking about women owning their power and going after things that ignite their passions, you know,
Mhm.
without fear of rejection or whatever. And like you said, you know, we are lifelong learners. We are going to gather lots of information. We're going to distill lots of information that makes us qualified.
Yes. If there's nothing else, we know how to learn. We
Yeah,
know how to learn.
and learn and learn and learn.
Yes.
So, you know, I really enjoyed talking with you. This has been
Thank
wonderful.
you.
We are getting a little bit short on time. So I want to end with the question that I'd like to ask everybody. So if there is one piece of advice that you would give us to up level our navigation of the healthcare system, what would that be?
Yeah. I'm gonna answer it, but it's three parts to my
Okay.
answer because I have developed a GPS framework for navigating the healthcare system. And I think this applies whether you are an insider in the healthcare industry or whether you are outside of the healthcare industry. But the G stands for gather information. And that really, the crux of that is asking questions. I always tell my clients, my friends, my family members, when it comes to navigating the healthcare system, there is nothing more important than asking questions, being curious, and not being afraid to ask the doctor and to make sure that you have a clear understanding of what they're saying. To, you know, to say like, could you say that again? Or I'm not really sure. And to really just always question in a very respectful way the information that is being shared with you. Just as an example, if you're being discharged and they're telling you everything's normal, but you see that, you know, your heart rate on the monitor is bleeping red, then you say, doctor, you know, you're saying everything's normal, but I see on the monitor that my heart rate is red and beeping, or, you know, could you explain that? Like, it's just always asking questions and also just gathering information about your own medical conditions. If you're caring for a family member, about their medical conditions. So that's the G, gather information. The P is to position yourself as an expert. And that really revolves around owning your power as a patient, as a caregiver. Yes, we're doctors. We have been to school like a long, long, long time, but we're not the experts in your body or in your loved one's body. And so I'm always elevating the experience, the expertise of patients and family members. Nobody knows you better than you. Nobody knows your mom, your dad, your husband, your kids. And so really positioning yourself as the expert when you show up in medical settings and having that degree of confidence. But again, being respectful. And then the S is to speak up for yourself. And that's around that whole advocacy piece. And that's really what I had to do more often than I would like to admit with my dad. If something doesn't seem right, I don't care how many years of school they have. If something doesn't seem right, you're probably right. And so speaking up and asking about that, having them recheck things. You know, if information is being presented that's incorrect, if they're saying that you're on a medication that you're not, or your parent had a surgery and you're like, they didn't have that surgery.
Yeah.
Don't just sit back and not say anything. Correct that information, because sometimes that information is wrong. So gather information, position yourself as the expert, and speak up and advocate for yourself.
Well, you heard it here. So thank you. So really, you know, it really is about knowing what's going on with you and taking ownership and not being afraid. You know, I think a lot of people look at the doctor as being up here and they see
Yeah.
themselves down here. But you know, we need to understand that it is a partnership. And you are, you know, like the biggest stakeholder because it's your body and
Yeah.
it's your health. So tell
Right.
us, if we wanted to work with you, where can we find you?
The best place is to go to my website, which is yourgpsdoc.com. You can also, there you'll see the different, you know, speaking, you'll see the healthcare advocacy, the consulting. So you can get all the information there. There's also a blog with lots of useful information for people who may be struggling to navigate the healthcare system. And then you can also follow me on social media, Instagram, Facebook, Twitter. If you search Your GPS Doc, you can find me there as well.
Wonderful. Well, I have enjoyed so much talking to my home girl here. The Maryland connection. I went to Georgetown for med school. I went to GW for residency.
Oh, see, okay.
So, I've been pretty local, most of my career as well. I slipped up to Delaware for a minute during internship, but that's it.
Okay.
But anyway, so so I've enjoyed talking with you. Thank you so much for sharing with us and inspiring us. It has
Thank
been
you for having me. This was awesome. I really appreciate it.
Thank you so much. Take care, everyone. We will see you next week. Bye-bye.